No, they didn't, but I'm gonna go with the flow.
Well, I did.
That's what I'm talking about. Oh, well, anyway. Okay. Hello, America. We're live. Welcome to the Health Tech Talk Show. It's May 1st, which is exciting. And Lisa is not
Mayday.
I'm in my house, and our special guest Boyede and Melissa are in the same exact house in the same exact position today. So weird. Oh my God. We don't even
Amazing virtual background there. In fact, you know what May Day is, right? Kat?
I don't know.
How do you feel about workers' rights, Kat? You want to talk about them?
Lisa,
Good, bad, neutral?
Talk about it so you get rid of Boyede.
Okay.
I just like, as long as if we're not talking about unions, then I'm into it.
We're talking about unions.
I'm not into unions. Okay, Boyede. So Boyede is from Zebra. He is here. He's going to tell us some things, but we're going to save his reputation for a little while we talk about unions. Lisa, I don't like unions.
I know you don't. But I had to point it out. May Day, workers' rights, labor, go labor.
Just so everybody knows.
Weekends brought to you by unions, Kat.
Yeah.
She's all, what's a weekend? Never heard of it.
I don't feel like this is a good conversation for her to partake in. Like, she doesn't.
That's true. Kat is a boss. She's a boss. She is not part of the union. She is management.
I don't believe in unions. In fact, like when I listened to the old Starbucks CEO who was so upset that his employees unionized after, like, everybody's like, Starbucks sucks, like, because he was like, actually like fucking with the locations that unionized. I'm like, listening to it was like on the Daily or something.
Baltimore was like one of the first unionized like locations for Starbucks.
So I forget his name, but he was like so personally offended. He's like, I have done so much for these people. And like, I was maybe the only person in America who was like, I hear you, man. You did do a lot for those guys.
You're all poor CEO.
I was like, man, they don't even know how good they are.
She's the only one crying for the CEOs. Just Kat. It's just Kat.
It was just me. I should
Nobody else.
In the letter be like, listen, I get it. Like,
I feel ya.
Oh my God. Yeah. I felt that guy. Okay, Melissa, anything you'd like to report?
No, I'm good. I'm gonna go downstairs so Boyede can come and like hang out in this area.
In your magic teleporter machine. Love it. We made this image for you, Melissa.
Yes.
Right.
This is us with money, which we don't have right now.
It's a false advertisement at this point, guys. You all know my deal. We need sponsors. Call, text, email, Slack, all the things.
Call us.
Yes.
Yeah, we'll call Melissa. Don't call us. Yeah, whatever.
Yeah.
Okay. Amazing. All right, Melissa. We'll send you wherever you're going. Okay. Lisa.
I love that outfit I'm wearing. It's very interesting. Yours too.
Yeah. I feel like you like.
I don't know what's going on here.
Real good in this.
It's really. It's a lot. Yeah. It's a lot.
I love that you're still like. This is the opposites. It's like you're dressed like a corporate boss, and then I'm here like casually it up like I live in California.
It's literally the opposite right now. It's like 100% the opposite.
Yeah. Look. I'm actually wearing a blazer.
I was, but I took it off. I was like, I don't want to throw on the talk show.
Yeah. OMG. Anyway,
wow.
Yeah, it is a talk show. Okay.
Listen, America, there is a lot of stuff going on. We cannot talk about all of it because contrary to popular opinion, we do keep secrets.
Yeah. It's such a freaking bummer.
It's real bad.
Yeah. And then, but don't worry, when the news comes out, we'll try to claim that we knew it all. So it doesn't even matter if it's true or not. Like we're going to
That is right. That is right.
Yeah. Okay. All right. So we're going to start off with something we can sort of say, and that's that you guys, I mean, I don't care about Kidney X. Maybe I do. I just don't know about it. ONC is like kind of back. Like,
yeah.
They're like people are into Tom Keene and like, I think they're back.
Yeah, Tom, if you're listening to this like on your like treadmill or whatever, on your run, like, 2 thumbs up, you know what? You continue to be a rising star, Tom.
No, I mean, that's what I heard. People were like not in, and I also like, we're not sucking up to Tom Keene because as everybody knows, when we don't like someone, we talk about it. And we have previously said we were unhappy with other national coordinators, like publicly. So like hopefully everybody knows that we're into that.
Tom's doing a great job. He was handed like $5 and like a ragtag band of folks, some of whom were very great and good friends of ours, and he's like done a really good job of like keeping it together. So good work.
Yeah, because I mean, like super strong, like actual could have been legitimate rumors that they were gonna get abolished or merged or something. And like, I just heard this week from relatively important individuals that like they are now national coordinating again.
Yeah,
maybe,
I like it.
Maybe it was all the name change.
I like it, and as I've noted before, I really liked HTI 5. I really hope that they finalize that as proposed. There's some really good stuff in there that is really like continuing to break down the pervasive information blocking in the healthcare data world. So I like it.
Well, you know me, I kind of just wish we deregulated all certification generally, but you know, a girl can't have everything she wants.
Yeah, exactly.
Yeah, Tom Keene, next time try harder, just deregulate everything. That would be great.
Don't listen to Kat, Tom. Seriously, do not listen.
You know,
don't listen to her. It's not. No.
Yeah, whatever.
I don't like it.
Doesn't matter. Anyway, yeah, I hear they're doing the thing. I also think that like them becoming ASTP made a lot of people like eye roll, and them un-ASTPing, they were like, oh right, like these guys like do stuff. So strong moves. I hear they're back. I hear they're back. So
all right,
moving on. Okay. So back to our trend about MAHA potentially not being a thing anymore that anyone gives a shit about.
Yeah, I don't know. I mean, yeah, this was a whole thing. As we know, we still do not have a like permanent Surgeon General of the United States of America. New proposal here. I mean, clearly we're doing okay. I mean, I don't know if doing okay is the word. I think from a public health perspective, we're not doing okay. You know, is this an important role? I think it is important. Is it like directly like influential in changing these things? I don't know about that. We'll see. I mean, truly, actually have a upcoming podcast to record on the Policy Stack, my other podcast, which is going to touch on MAHA and prevention and what it really takes to get this work done, with the hope that prevention and preventative care is something that we can all agree on. But there are some contradictions, as you have noted, in the funding environment as it relates to prevention and public health. So gonna explore that more.
You know, I think like public health, just like Tom un-ASTP'd themselves to ONC, I feel like public health should just like unpublic health themselves and call themselves prevention and be like down in front. Like, you know what I mean? Like, yeah, I feel like everybody's like, public health, they're the worst. Even though it's like people who like make sure your restaurants don't have rats in them and stuff. I don't know, like whatever. But anyway, yeah, so President Trump has unnominated Casey Means. I feel like this is probably a good thing for America, y'all. As someone who is pro people doing whatever they want, I feel like she also was not advocating for things that are useful. And now we have Dr. Nicole Safir, I think is how you pronounce her name, who's a radiologist and slightly skeptical of vaccine mandates, not vaccines, just mandates, which may be a little bit more popular with the Senate. Also, people were, I think Trump like blasted Cassidy for Casey Means not advancing. However, she says it was Lisa Murkowski. I don't know. All I can say is God bless you, Lisa Murkowski. I feel like, you know, Alaska, even though they're Republicans, they're like a weird kind.
They're like a very weird kind. Yeah,
like
but I support it.
Hands off my individualism and freedom and liberty. Yeah,
I support it. I support it.
God bless you. Yeah, 100%.
Good stuff.
Do it. Yeah. Okay, here's the thing. So we're like, oh, like people aren't into MAHA anymore. And I think that's like kind of true that people care less generally. However, in recent news, we did find out a bunch of insurers, we found out, aka Politico sent us alert, that insurers are now covering some functional medicine stuff, including lifestyle, diet stuff, things like that. So that's kind of exciting.
Yeah, there was this one company which has existed for a while called Parsley Health that does some of this like functional medicine stuff. And they were like, they were interviewed by like Politico and others who were like, and they said, we had never imagined that like health plans would cover some of this stuff. This is crazy. But then they were like, we are not affiliated with MAHA. They're like, they're like functional medicine, yes, not affiliated with MAHA. And I was like,
we were here before MAHA.
We were here before MAHA. But you know, whatever. Like I think we have a lot of work to do on the health of Americans and whatever.
Yeah, I agree. Generally, again, like I think no one disagrees with like the core principles of MAHA, which is like don't eat shit, like, you know, reduce exposure to chemicals, blah, blah, blah. In addition, it looks like Maha is, again, like we're having more rational people put in place. I don't know how to pronounce her last name, but I'm into it. I love any name with a Z in it. But
Zarama.
Catherine Zarama, she's replacing Vinod Prasad, right? Vinay Prasad.
Yes.
I can't remember his name. It's good that we don't remember his name because, like, apparently this guy was not exactly the best. So I think he already has exited.
Vinay Prasad. We just both got it wrong like dummies.
Whatever. Anyway,
yeah, Vinay was a very controversial FTA director. So yeah.
And if you remember, he was uninvited to his job earlier, and then rumor, I guess what was reported is Susie Wiles brought him back.
It was one of those like palace intrigue situations that we will never understand.
Yeah, well, wasn't it Laura Loomer went after him or something? I don't know. It was like, wow, like it's hard.
I found myself on Laura Loomer's side many more times this year than I would have ever expected, which is very weird.
I know. Like, anyway, so we can't pronounce your last name, but we assume it's Zarama. She does have some pretty strong like career Fed experience. She was at Arnold Ventures for a little bit, has some real experience. So this seems good. This seems like another more toward the center right, as opposed to whatever we were going toward. So that's great. Excited. In other news related to Maha-ish, I don't know enough about Snap, Lisa.
This has got to be a Tyson's food thing, man. Okay. Like, whatever.
Okay. But like, can we actually talk about this? Because I did not know that hot meals were not, like you couldn't buy them with Snap. Like, I didn't know that.
Yeah. As someone who grew up on Medi-Cal and SNAP, I can tell you it is a very limited, it's extremely limited. And you can say like, well, people should cook. It's like, cooking also isn't super cheap. Like, by the way, all food stuff, cooked and uncooked, is expensive. And, like sometimes there are things that are better nutritional value, will feed your family faster, can be prepared or served immediately when you don't have time to cook. And that's important for people who are on SNAP as well. But yeah, I have to assume, however, this is like a Tyson's food, like we got more chickens to sell situation.
I don't know. I read this, and again, I learned Politico did a great job of explaining to dumb people like me, like why this was a thing. Yeah, it said like all the food that you buy with SNAP, it's meant to be cooked at home, like whatever, cool. But okay, as someone whose mother loves a rotisserie chicken and buys rotisserie chicken whenever she's visiting or I'm visiting, and she's like, "Oh, babe, there's a rotisserie chicken in the fridge," right? Like, I know how much they cost. I also do not buy rotisserie chickens, and I make my own, right? So I buy a freaking chicken, a raw chicken, butchered chicken from the store. My chicken costs at least $14. The rotisserie chicken that my mother gets from wherever she gets it is like
mysterious.
It's like $8.99.
So, and Costco is even cheaper, I think. Costco has like a sweet price there. Yeah.
Well, and there's been all this, there's been all these podcasts about rotisserie chickens, right? That it's like a loss leader to get people in the store. They buy other things. Like, I think like Costco or Walmart someone has, they've refused, one of the chains has refused to ever raise their prices on rotisserie chickens. So it actually is a phenomenal deal, and it's going to feed a family of 4, probably. I mean, I feed a family of 4 with a chicken. So, I assume, I don't know how much chicken people are eating, but it's going to be dinner, right? That's like a pretty freaking good deal. And like rotisserie chickens aren't gross. Like, they're not like fried. They're like just rotisserie.
Roasted.
So,
rotisserie.
Anyway, what this kind of said to me was maybe I should learn more about SNAP, which historically is kind of like, it's like not at HHS. So like, therefore I don't think about it, but yeah, look at Melissa, $4.99 at BJ's Wholesale. What? Yeah, that is a cheap meal. Just saying. All right. Lisa's done talking.
I'd eat it.
Okay, but in things that maybe are not great about the Trump administration, as everybody knows, the exchanges got hit pretty hard, and our friends at Cigna, I don't know if they're our friends. Maybe they are. They're out like shout of the exchanges.
Yeah, this is rough, right? This is going to be a rough situation. I think, we knew this was going to happen, right? With the subsidies and the, lack of extension and, the conflict in Congress, and insurers saying like, well, screw you then, right? Like, it's definitely a way to like collapse these exchanges, and that's a problem, as you know. At the same time, Kat, like when I think about it, like I've been kind of mulling it over in my head, and I'm like, are we at the tipping point where people are like, insurance is not worth it anymore, right? Like,
Well,
and we're
have
just at
told me
that
that.
place now.
Yeah, you've told me that a bunch of times, right? Like you're like, meh. I mean,
Uh,
okay, so I had to fill out a bunch of forms for my kids' well visits, whatever, and I'm just like looking at the card. I know how much my insurance costs because I am an owner in the company that pays for it, so like I know like how much it costs, generally, like including the company side. It's a shit ton. Like it's like well over $30,000, and on top of that, my out of pocket max is like what, like 10K. Like.
yeah.
No, y'all. And thankfully, I have not had any sort of catastrophic event where I've ever gotten close to that. But yeah, like if someone just gave me 40K, I think that'd be better.
Yeah, I honestly like I at this point, like, who are the insurers who are going to create a truly catastrophic coverage level? I'm sure there are still some policy barriers to that, but like, can we get a like non-standard, like off market something that is like truly catastrophic coverage with the collapse of the marketplaces? I think most people now can say that their insurance, even employer sponsored insurance, is unaffordable. There's a specific number, like compared to your salary, where you can say, like, hey, the cost of this is unaffordable. So I think more people are moving in that direction. They can say, I don't have an affordable offer of care. So what does that look like? Who can are there insurers who can create, maybe even non-health insurers, but insurers who can create a truly catastrophic level of coverage where you're like, let's say, my house burns down and everyone in my family gets cancer, knock on wood, right? Like what is that situation versus like, I have a regular health event that I need to pay for in cash. And by the way, I'm going to get a better deal if I pay for it in cash. I just think we're moving into that world now. It is, a lot of people have very unaffordable offers of health insurance and coverage.
Yeah, like, I mean, even if someone
Not
only gave
good.
me 20 of the 40K, I mean,
Seriously, like I mean,
know.
I'm like, we all, if you take a look at your health insurance, like, unfortunately, pull the band-aid off. Like, I personally want to ignore it because it's like so bad. Like, look at it and say, like, holy crap, like, look at how much I am paying. And the requirement to have coverage at the state level, at the federal level, is like very easy to poke holes in right now. Like, you don't really have to have it anymore, just to be clear.
Yeah,
And so, like, what are you paying and what are you getting and what would you get if you were negotiating cash? And then it's all very well and fine until you have like a major serious incident or accident or something really, really bad happens. So what is that level of insurance coverage that will actually cover you for like a truly catastrophic event? Can we,
Yeah.
I guess, do we have to move there now? Like, someone who loves health insurance, who's not me, like, let me know your thoughts.
Yeah,
Like,
let us know.
I know what health insurers and health plans do. I know it is important. I work in the space, but like, please tell me how you think people, families, individuals are going to be able to pay for this stuff now. It's
Well,
insane. We are in insane territory.
it's not sustainable. And like, again, like
Yeah.
I think we do a nice job at incentive covering as much as we can on premiums. We don't cover 100%, right? But
Nope.
of families or anything like that.
Very few companies are doing that still.
But again, we're small, and we had a 16% increase this year. Like, and we had Clay Ferris on a couple weeks ago, and he talked about the same thing. He's like,
60%.
I think we're fucked. Like,
She's like, it's over.
Yeah, he's like, it's over. Like, it's unsustainable. People can't do it, and that's that. So I don't know. We'll see what happens here. Who knows? Like I said, like sometimes I see
look where your tax dollar is going. Kat's other favorite topic. Look where your tax dollar is going, and look what states are paying for and how they are trying, like, and failing in many cases to cover really critical care. It is rough. Most of states' budgets are going to things like Medicaid and food assistance and things like that are really critical. Like, we are in danger territory. The whole system. Now I've like
Lisa,
totally, like, everything Clay said is like went in my ear and like percolated around for a while.
But like, can we talk about the billionaire tax? Did you vote for the billionaire tax?
First of all, we haven't voted yet, and I absolutely will vote for it.
Well, it was signatures, right? So it's on the ballot.
Yeah,
You are not going to vote for the billionaire tax.
I'm gonna write in Kat McDavitt. Kat McDavitt told me to vote for this. All right.
No.
Kat McGavitt endorses this vote. I'm going to write that in.
No. Ugh, I am so like, listen, fight me. I am so not into the billionaire tax. I think it's like the worst idea ever.
I love it. I'm gonna put I'm gonna donate to the cause in honor of you.
You're just like put a sticker of my face on your ballot, just put it in. I don't know how your voting works. In Georgia, they like print it out for us and we like go put it in.
I don't know either. I don't know. I think they've
Put my
changed a bunch
picture
of
on there?
things. Yeah, we'll find out. I'll put your picture on there.
Oh my god.
Bring you into the voting booth.
Whatever.
Amazing.
I'm like anti-billionaire tax, whatever. It's fine. Not that I'm anywhere close to a billionaire, but if I was.
But she wants to be, folks. She wants to be.
Obviously, I want to. Okay, so here's big drama, y'all. Big drama. Okay, big drama. So yeah, so Lisa sent this to me, and then 400 other people sent this to me. So Lisa, tell us what happened.
Yeah, I mean, it's so funny. I was watching all of the commentary back and forth on the LinkedIn and on the Slacks. So as we know, CMS, Medicare are working to bring together a provider directory. They're trying to create kind of a utility or they're thinking of provider directory as a true utility. It's like the modernization of a bunch of older programs. And they stood it up. Everyone is working really quickly there. They have really, really tight deadlines as far as I understand. They're trying to get things done in time. And so they pushed this thing live. And according to the folks who were quoted here from CMS, it went live and it exposed the social security numbers of some providers. This is not about patients or Medicare, but it's about providers who have NPIs, National Provider Identifier numbers, who are Medicare providers who are enrolled with Medicare to provide services and bill Medicare. And what the CMS spokesperson said is that it's because the providers inputted data in the wrong place. I don't know. That's what they're saying. Regardless, it's not a good look. People are obviously very upset. I think they pulled everything down, or they pulled part of it down, and they're trying to fix it probably very quickly. But yeah, I mean, who knows? That's what they said in the piece. One thing you have to understand, loyal watchers, listeners, is that it's not no offense to Dan Diamond, who is a very good journalist, but it's just so you know, it's not that they're doing amazing gumshoe reporting, investigating. He is a good reporter, he's a good investigative journalist, not insulting Dan, who is great, but please know that someone told them where to look.
Yeah, you guys,
please understand 100%. That any article you see is someone leaking information to somebody else. Then you have to ask yourself, why was it leaked?
Article, and I don't know, did Dan write this one? I don't know if this one was Dan.
I think he was part of the group. Whatever. There's great journalists here. They do good work.
Sorry.
I'm just not dissing Dan, who's a wonderful journalist, as are his colleagues, just to be clear.
Well, a lot of times there are tips, right? Anyway, but if you read this article, they even say finding that data is not immediately apparent. You have to even acknowledge them there. You have to
be clear, guys.
Yeah. Okay. And here's the thing, y'all. I would like to say this. I do know it's hard to put together a national provider directory. I know a lot of people do not want a national provider directory.
Also that.
Of the things that are messed up in our great federal government, why is this the one that got coverage in the Washington Post? Correct. That is what we will leave you with, America. That is why we would like you to use your brains. Okay, moving on.
Questions.
Ask questions. But in this is also hard, right? It is hard. It's hard. People are why can't we have a national directory? I don't know, y'all. Why can't we have a national health information exchange?
Yeah.
I don't know.
It's hard. It's complicated. It's never as easy as somebody on the internet would like you to believe, including us.
Yeah. I mean, we also, as we should always say, we are not real news. We are not doctors. We're not really anything. We're just two friends on the internet just saying some stuff. Some stuff. Okay, so we're going to talk about this. So speaking of why we don't have a national provider directory or national health information network or so many other things, because we are a country of states and we believe in states' rights over here.
And territories too, also, weirdly.
And territories and tribes. We got a lot going on here in America. And I mean, I don't know what Lisa feels these days, but I'm generally anti-central planning. But we've got some stuff going on with the states and health data privacy regulations. And there seems to be some drama
Yes, I was interviewed for this by Michael, and talked about, how HIPAA was always a patchwork. Remember, HIPAA only matters if based on who was actually like processing the data, and it's a limited group, and almost all of these health tech companies are like not part of that. And all that information you provide them, your Aura Ring, your Apple Watch, your Whoop band, your whatever it is, like all that stuff. It's just it's not part of this for the most part. And there's just limited enforcement. I will say the enforcement may still be coming, right? We are hearing all kinds of
Yeah.
rumors over here at the Health Tech Talk Show about enforcement of different kinds from various different federal and other bodies. And then there's also a bazillion lawsuits all the time. So just like know that like there is some interest, there is some move, but just remember, I'm okay with you all having my health data. I'm okay with it being sold across the world. You may not feel that way, and you should know that like you are not protected by any of these laws you've heard about, and they don't do what you think they do.
You should generally just like decide what you think about. You should
Yeah.
decide if you care
Yeah.
about that, and then maybe just don't click all the
Just like
agrees
act
on your
accordingly, right?
on your T's and C's. But yeah, there are rumors of much like what we're about to talk about, which is AI policy in the States, that there will be some sort of national moratorium. It's just going to be like whatever, because this administration wants AI to succeed, it wants data flow to succeed, it wants all those things. So TBD. But yeah, so this is something I pulled from Cooley because after reading that article, I was thinking about, I wonder how all the states are doing.
How is that going?
Yeah, the states, okay, as everybody remembers, like late 2025, the president put out an executive order saying like, you can't do your own AI laws, states, because someone had found that there's some research out there, the states have like over 1,000 of their own individual AI laws coming out, which makes it really difficult for tech companies to operate. However, several of the states are doing it anyway. Some of them had laws before that. Lisa, one of those states is yours, California. God bless them. God bless the People's Republic of California and all of their things. So, I think you have two going through that are causing, at least in our industry with health tech vendors, are causing a lot of concern because it's like, it requires all this individual dev work to work in some of these states. Colorado also going forward and don't really seem to care that there's an executive order. Utah has its own, but they are very favorable to AI that we'll talk about in a little bit. And then there's one more that I cannot recall. I think it's a little one that are just like doing stuff anyway. I think a lot of them are doing it anyway, but those are the ones that have consequential AI things going on. So I don't know. I mean, this is one of those like proceed at your own risk things. It reminds me of all the ABC laws with Uber, like when Uber first had its whole, our contractors, employees, and maybe they hate unions too. It's unclear.
Our drivers are not employees forever and ever, is what they've all said.
Yeah,
our delivery people are not employees, etc.
Yeah, it made it difficult for those companies to expand in certain markets. Now, thankfully, they had bajillions of lobbying dollars available to them and have largely won. But I'm not sure how that'll go in health tech land. So
I don't know, because at the end of the day, like who's left holding the bag here, right? There's all kinds of private action that can happen and will happen, right? AI systems will make mistakes, and they'll make mistakes because like they're built on unstable foundations, and like you can't just like set loose a like foundation model on a healthcare workflow that touches a patient, reaches a patient. And so like they're gonna fail. Humans also make mistakes in healthcare. We all know that. So will AI systems. Some will be the same, some will be different in a worse way, whatever. Like all those things are going to happen, right? And who's going to be holding the bag? It's probably going to be the providers, and they probably don't like that idea, and rightfully so. So they're going to be pushing for laws and guidelines and frameworks and things that they can point to.
There's a lot of, a lot of the VCs, at least at JPM, remember the talk was like, we need a liability shield for health tech companies if they want us to expand AI. And the administration was like, I think that was, those were from conversations with Jim O'Neill, who's no longer in his role. So maybe things have changed, but I don't know, that's kind of scary on both sides. Speaking of, so everybody, like we talk about Doctronic a lot. Last week, this came out, I think it actually came out on the day of our talk show. So we like obviously didn't talk about it, but Doctronic, this is Utah's state pilot on AI. It's very much more narrow than people often know, but it only is for refills of certain drugs. The Utah Medical Board came out and said, F you, you never even called us, and are demanding that it is immediately suspended. I don't know if it actually has been immediately suspended because the state
I
claims
don't know that it has been suspended. I think that
I don't
was
think it has.
them demanding it, right? Like,
yeah. And the state was basically like, oh no, this is only part of the article, obviously, but the state was like, no, like, okay, we thought we called you, but if we didn't call you, but we think we did, but we called everybody else, and they all said it was fine. It's what they said. But
I think this was all intentional. This was all intentional. It was all intentional.
Yeah, I think there's, because Utah does have a very favorable.
Utah did this on purpose, and like honestly,
GST.
like they were saying this is all listed, I think, in the Commerce Department in the state of Utah. I don't know what it's actually called, like commerce, like not in like healthcare, Health and Human Services. I think they were like, we're gonna do some stuff, and like we're not including the guilds. Sorry,
they're like,
this
no.
is intentional.
And it was actually reported that they, so the state was like, no, we think we called you, but then apparently it was first reported. We think we called
you. We sent you a text.
Yeah, it was reported months ago that like they actually didn't. So whatever. But here's what I thought was super interesting. So everybody's like, wow, like Utah does everything electronically now by the AI. It's okay. So among the safeguards in place during the initial phase of the pilot are that the first 250 prescriptions across several medication categories must be reviewed by a clinician. The bot has not yet met that threshold. So y'all, a very small number of prescriptions are actually going through Doctronic, and they are all currently being reviewed by a human.
It's a very, very, very limited pilot. And to be fair to Doctronic, whatever you think, like they did design a many safety thresholds. They also report that they have medical liability insurance for their system. Now, I would love to learn more. I'm sure they won't tell us. I'm sure the insurer also won't tell us, because this is like a bleeding edge area of this work, right? Like, but they did design this now. Now there's another company, Legion Health, which is a Y Combinator company in the space. And they're also doing, or they're starting or planning a pilot in the state. And that is around psychiatric medication refills, which is significantly more risky. Doctronic is doing like very low risk refills of like non-opioid, non-Schedule 1, like very, like they've, like, again,
it's like
it seems to me
or something.
Totally. Like I think Doctronic like really narrowed it down. I think Legion Health is in again, somebody who could fact check me, or I think it's in the psychiatric medication space, because their whole thing was like there aren't enough prescribers for psychiatric medication. There aren't enough psychiatrists at all, and it is like a huge need and needs a lot of oversight. So they were like, that's the area they were targeting. That is significantly riskier than like a bunch of like generic meds that are not for like super serious conditions. So I will be interested to see what the Utah Medical Board has to say about that.
Agree.
Let us know if you have a tip on this front. Like, we would love to hear more.
Also, like Doctronic and State of Utah Commerce Division or whatever, like come on our show, like call us.
Yeah, let's talk. Let's talk.
Come on our show.
We are interested.
Okay, so speaking of moving things quickly, well, everybody complains about the FDA moving too slowly, and we did hear from Lucia about the FDA killing a good company last week and like all that stuff. But they are announcing progress toward keeping their promise to make things go faster. They announced two things last week or this week. One is 2 proof of concepts to see how the trials work if the real-time trials go well. And then there's also an RFI out. So like America, go respond to the RFI, get your comment on public record so that people actually read it. Gossiping and talking on the Health Tech Talk Show, while we think it's useful, apparently is not official. So you kind of have to respond to that.
Yeah.
I thought this was interesting that this has been extended, just like some other things in CMMI, the generous model. And it looks like the states always had till September 10th to apply, but manufacturers now have an extension. So I was like wondering why, or is it just because like people are busy?
I do not think that the pharmaceutical industry is particularly interested in providing more discounts to the US government. That is my take on all of this.
Yeah, I feel like they think like we're done.
I feel like they're like,
did
we
that.
did it. We did what we're gonna
did
do.
that.
We're not interested in doing more. And that's a bummer because again, like one thing I will say, the US still pays a dramatically large amount compared to everybody else. There's lots of reasons for that. It's not a super simple concept, but the reality is that we pay a lot for drugs, for comparable drugs. One interesting thing, your favorite topic, semaglutide Ozempic is generic now in Canada, and they just accepted their first application for a generic manufacturer. So within the next like couple months here, there's going to be generic Ozempic semaglutide on the market in Canada. And how many people do you think, Kat, are going to be making that drive and fighting with the Border Patrol about importing their meds?
Well,
a lot.
Probably a lot. Probably a lot. I don't know how much of the US population lives on the Canadian border, but I know like something like 80% of the Canadian population lives like 20 miles from the US border. It's something like that. So I don't really know how the reverse goes, but I will say like, you know, Canada's cool. Like I'm here for it. I say like I am not totally into, I would not want to live in Canada for like drug purposes because they're the ones who had to deal with the AstraZeneca COVID shot. And apparently it was just like, you know,
AstraZeneca was not great, just to be clear.
it was like
Sorry,
drinking a cup of lemonade.
like,
didn't do anything. Yeah. But I mean, that's actually the only criticism I have is remembering how we had a better
importing. Probably what will happen here is that importing will come up again. I mean, to be clear, like Novo Nordisk and Eli Lilly are reducing the price of, they're finding ways to make it cheaper for cash pay customers here in the US. Like they are bringing those costs down. They have a lot of room to go, I would say. But like as like people try to start importing drugs or self-importing drugs from Canada, which will happen. Also India, it's also going generic in India as well, which has tons and tons of manufacturers who do, you know, legitimate and high quality pharmaceutical generic manufacturing. Like this story is only expanding. I have to say, I appreciate the administration for, even though I don't think that the methods have been particularly effective so far, putting more attention on the cost of drugs that Americans pay. And, you know, I don't know if these particular programs are themselves driving the cost down, but quite frankly, there is a bit of like sunlight is the best disinfectant situation here.
Yeah, I'm not mad about the Trump administration trying to get us cheaper drugs. I'm not mad about it.
I would like cheaper drugs.
Canadians, I do not like your taxes, so that's another reason I'm not going to go there. Look.
Catherine says.
You know what? I actually was going to bring that up, and I thought it was going to be too much of a side. So
I'm going to order Kat some generic Ozempic from.
Do you remember CanadianPharmacy.com and also my mother's favorite, MexicanPharmacy.com, and like she would buy all of she got 5 kids, right? Like you gotta maximize. And so I remember like these little like. Boxes coming from Mexico with all of our antibiotics. Oh my gosh! But then she said like,
Kat's mom importing ivermectin from Mexico.
I don't know if Old Ma is importing the ivermectin, but I think that she is a woman who will figure out things and get them done.
So my favorite thing, so obviously there's like the way that healthcare is delivered in other countries, obviously it varies in different ways, but in Mexico, you just go and you like buy something that you can randomly inject into yourself. Like let's say anti-nausea medication. In the US, they think like Americans are too dumb to like inject themselves with like medication. In Mexico, they're like, here's the medicine, here's the syringe, figure it out. And like, it's just a different like take on what consumer patients can actually do. And like, I don't think they don't trust us very much here. The end.
The end. Okay. So there's been a lot of scuttle on Devoted. And people think Devoted has the feel good vibes. I've met people from there who have the feel good vibes too. This was, I think, Todd Park and someone else's company. It certainly has tried to do the good guy stuff. I think they even had an article today about both this one saying that they were not doing great. Like it's been they've had like a decrease in subscriptions or decrease in renewals or something like that for the first time ever. They have like they're on year 9. Again, most investors expect returns, before that. Things are slipping. And they also apparently put out an op-ed or something saying CMS should pay them less. I don't know. I mean, I don't know how you feel about this, Lisa, with your feelings about things.
I love it when people who are like health tech or healthcare, like founders or entrepreneurs, make like big statements in public about their alignment with ideals, which is what happened here. They made a bunch of big statements and then the actual like financial results were opposite. Like shout out. Apparently the CEO said like, I think government should pay us less, which is like funny, right? To me. I mean, it's good. Like, I agree. But like,
yeah,
the reality bites, I guess.
Yeah, reality.
Like how I would describe.
I think that's like a good statement to move on from. Okay, great. So we got a couple more slides here, and then we're gonna go to our special guest. So Dr. Oz is coming for you, Texas. The only thing I'll say is I feel like Texas's people back when they come for Texas. So like I'm interested to see.
Have you seen the lawsuit between Texas and Epic? So whatever.
Like I also think like the thing about Texas is like California doesn't care either, right? Like your governor is just like, come and get me. Like here I am. But he does it in an eloquent way, usually. Texas just like, they do whatever they're going to do. So I'm excited to see what happens here. This is also hospice related, apparently. So yeah, but again, like this is like it's like not bad to find fraud. So we're super supportive. I am just excited to see the headlines that come out of this effort.
Yeah.
From Texas specifically. So
I think this will be interesting.
Two more exciting pieces of non-government news. One is that, kind of feels government-like to me lately. So like, I don't know, but this was, what's his name? Viva. Yeah. So Nick Frenzer used to work at Epic. I think we actually like met him when we were out there. The one time they let us cover their conference, lol. And Viva had sued Epic over their non-competes. They are both located in or around Madison, Wisconsin. And so a judge dismissed it. They threw it out saying that only employees can sue for that. And you are not an employee or former employee. Well, he is, but the company's not. So this is a LinkedIn post from Nick saying, if you are an employee or former employee of Epic, you should sue them.
Yeah. I mean, listen, I wish them luck. I hope it works. I think it's an unconscionable term. I don't think employees should be held to those kind of things in any situation,
totally
for any company.
I totally agree. As someone who is pro-employer generally, like non-competes are so dumb. Like if you lose someone, like that's on you. Like deal with the consequences. I do believe in non-disclosure agreements. I'm down with that, but yeah, you can't tell someone they can't go work for a competitor. Like go to hell. Like you suck.
Yeah. Like, yeah. If you don't give me like a amazing like contractual agreement that says like you can't fire me without giving me like 6 months to a year notice, and you have to give me this amazing like severance, then I can work for whoever the F I want. Like seriously. Give me a break. That's ridiculous.
If your employment agreement, if you're lucky enough to have like a real one, says, if we fire you, we'll pay you a year's severance, but your non-compete is also a year, like, okay. But I mean, come on. This is just like little league bullshit. Non-competes are so dumb. I can't even take it.
Totally.
It's un-American. Okay, last thing. Congratulations to Otto, Sipe, and team at Photon for raising their Series A. Otto
great.
was one of our first guests, and he bashed pharmacies for having cigarettes and stuff, and he was drinking a Diet Coke, and it was like the best. If you have not read Otto's posts or any of the job descriptions at Photon, they are an entertainment just in themselves. They have like a whole culture about being sewer rats and building in the dark and like.
Otto is so cool. Like, by the way, everyone, they're hiring for a partnerships leader. If you want a job with a freaking awesome company who is doing really cool things, you should apply. Like they're so cool. Honestly, I would absolutely work there if I lived in New York City. So, just hit them up if you live in the New York area.
They're really cool. Also, they have a real product. It isn't just that we think
they're so good. They have great marketing and great vibes and great story and great perspective, and they also have a really awesome product. So hit them up.
Prescriptions. Yeah. Okay. All right. Yeah. Now it's time for our special guest who has been patient.
Boyede.
Oh my gosh.
Boyede.
Oh my gosh. Oh, he moved houses.
Yes.
All right. Well, you stayed on, so we didn't terrify you. Yeah. I do see you have 2 chaperones with you today, so I hope we don't disappoint them.
Not at all. Not at all.
So tell us about yourself. What's the intro?
Well, first of all, thank you for having me. Thank you for welcoming me into your space. My name is Boyede Sobitan. I serve currently as the Global Healthcare Vertical Strategy Lead at Zebra. That could be a mouthful sometimes, so I gotta remember to kind of read the words out loud. I've been in healthcare for over pretty much my entire career, for over 2 decades. I started at the bedside as an ICU nurse here at the University of Chicago, one of the busier ICUs in the city. And I've kind of worked my way through different facets. I've taken a very non-linear path to healthcare. So I've worked in, I've been an administrative fellow. I've worked in physician practice management, clinical operations, consulting, finance, and now in tech. In this role, I kind of really serve as kind of bridging the values or the needs of the industry with the technological capabilities of Zebra and trying to really mesh the two. So I kind of sit at the intersection of clinical and technology.
That's awesome. How do we feel about the pit since you are an ICU nurse?
You know what? I've been told to watch that show. I have not watched it.
No time. I'm doing actual work. Like
I haven't watched
fair
it
enough.
either.
Fair enough.
I hear about it a lot though.
But it's going to be like I got a couple of days coming up, a couple of days off coming up soon. It's queued up. I have heard it's probably one of the more accurate medical shows out there. As somebody who kind of like laughs when people say like silly things, then like that's not real. So
there's actually an ICU. There's actually a currently practicing ICU nurse who is an actor on the show as well. It's just crazy. Like their commitment. They have active ER doctors who are writing, and they have an actual ER nurse who is like, I think he's an ER nurse actually, who is an actor as well. He's like a part-time nurse and a part-time actor. It's incredible.
Yeah, no, and I think that's the beauty of nursing. You couldn't tell me when I started my career that I will be doing what I'm doing. I'll be working in healthcare tech. I'm like, that just wasn't on the career ladder. But no, here I am, and I think that's the beauty of nursing. You can do law. You can be a part-time screenwriter for a TV show. So it's a lot you can do.
Yeah,
amazing.
Well, why Zebra? Why'd you end up with these guys? What made you fall in love?
I think the breadth of Zebra's both product, but also the reach. My role is global. So I get a chance to kind of see what's going on in Europe. I see what's going on in Africa, Latin America. And I think that was one of the bigger things. And I think also Zebra has a lot of cross-vertical depth. So we can learn from what's going on in retail and see if there's a healthcare application. So I think that was one of the things I really, really appreciated about the opportunity to work with Zebra. And also it's a company that honestly is a tech company that's 60 some odd years old, coming from not coming from Silicon Valley, but understanding and have researched Silicon Valley. That's like, how come I never heard of this company? It's usually kind of seen as a back office type company, but it's been around for so long. So their staying power also was something I was really, really attracted to.
Yeah. So I know like a little bit about Zebra. Like I think it was back when it was like RFID stuff and like tracking and like diversion and all that. Like what is you work globally, but maybe because like I mean we do have a global fan base. I'm positive. However, it does seem like most of our people are in the US. What's like your favorite use case in the US?
My favorite use case right now, and it's almost like asking me to pick my favorite child, but I would say the one that excites me the most right now would be the RFID use case we have going on at Texas Children's. We have a project there whereby we're able to track a lot of their high value medications no matter where they are. So we've been able to have hard ROI numbers as far as medication loss, expirations, and just kind of backdooring of medications has been totally, they almost are 99% visibility chain of custody for all their medications. So I think that was probably one of my favorite projects. And I think also it was one of my first projects. So I think it's another thing that kind of why that project's so near and dear to me.
Yeah. So it's not just like, I mean, we've heard a lot about this with like opioids and diversion, but you're just saying like high value meds in general.
Yeah, you'd be surprised. A lot of these cancer medications are very expensive. And then what happens is the medication comes in, is it not accurately logged in an inventory? The weekend happens where full operational oversight is not happening. not a medication expire, and that was like a $20,000 vial or
Wow.
$20,000 IV that's now has gone away. So now with the smart application of our technology, which that team down there is really hands on with it, we've been able to kind of reduce those things from happening significantly.
Yeah. So
there's probably a lot of diversion as well, that intentional and maybe even sometimes unintentional in different settings, right?
Quite possibly. That wasn't what they called us in for, but I'm sure that now with that line of visibility, there's a lot of more tighter controls around those drugs kind of going out the back door, or the diversion of opioids and things of that nature too. So kudos to that.
Yeah, I was even thinking more just like you just said, like something that's pricey, something that costs a lot of money and is desirable is going to have like some kind of diversion potential generally in different settings, especially when you get outside of, I don't know, like different countries as well. I'm sure it happens in the US too, just to be clear.
Yeah, I'm sure. Yeah, that's interesting though, because even like you're saying, even if it's just like an accident, like it was left out or whatever, and it's wasted, like that's a significant ROI, just being able to say like, yeah.
Exactly. And there's a lot of other things that we're doing, but I think that one, it's so cool because it's like this sensing technology that I know where things are. I can locate it wherever it is. If the CFO or COO calls about something, I can look at my computer and pinpoint exactly where their product is. So I think that's a really cool technology that we have amongst all of our other things that we do.
Yeah. Well, what's the AI story with Zebra? Because I imagine like simplifying workflows with all this and inventory, like I'm sure there's something going on there.
Yeah, so I think one of the things that Zebra is really has kind of is strong in and has kind of staked their claim is around data capture and identity. And I think when you think about AI, AI is very similar to like when my math teachers teach us how to use a calculator, GIGO, garbage in, garbage out. So if you don't have the right inputs and the quality of data going into a lot of these LLMs and a lot of these AI systems, you're not going to get quality outputs. So I think that's really a unique place where Zebra can sit, is really having the quality data capture parts to put in ingestion layers to then use more predictive or retroactively assessing different things, amongst other things. And then we also have work that we're doing with on-device AI. So if you think about the amount of cloud storage and usage that you have to use, the power you have to have, there's some ability to kind of have a little bit of a mixed environment to have AI running on device and what that looks like. So a lot of exploration, but I think that's where it really sits. And I think that's a place that we can have a little bit of a moat and a wedge.
Yeah, very cool. Well, you have an audience question here from our friend John Joshua. I don't know if he's our friend. I think he probably
He's
is.
my friend. He's my friend. He's my friend.
Okay. Listen,
John, what's up?
I didn't know if it is confusing to me because
it's a qualified question from a person in the space.
But a real legitimate question. Any other use cases for RFID that should be explored? He's saying he did a project at a health system for patient wayfinding, but there were very few solutions. So like what else is cool? Like what's like cutting edge?
I think wayfinding is a huge use case. One use case that's near and dear to me personally is patient throughput. You work in a hospital, which I have. There's an unholy alliance between the charge nurse and the nurses and the unit secretary. So I can get a patient and that patient could be discharged, and I'll tell the unit secretary, don't take that patient out the system because I don't want to get another admission. I want to take a break. But that's and granted that speaks to a larger issue around how do we assign patients, things of that nature. But what that does, or the implication of that type of behavior, is then that patient is holding up a room, a phantom room, so to speak, for a patient who needs to get it from the ER or a patient coming out of pack. So if we can know where that patient is, this patient here went through this door, this hallway, and out the front door, it hasn't come back within, let's say, a certain time parameter, 10 minutes or whatever, we can auto discharge that patient, auto make that bed dirty to then let EVS know that the patient's been discharged and clean that room. If we can get that level of RFID technology, which also can combine AI with RFID and RTLS technology, I think then we really have we really create a full sensing organization where we can be more predictive and also more intelligent with how we're using spaces and where we know patients are going. So yes, to that point about wayfinding, I think that's a good point, but also where patients are, or even to combine the wayfinding and the throughput. mom or granny or dad might be in the OR right now when you come up and you just see an empty room. And how many times you come to you're like, what happened? Where did they go? Did something happen? You can just look on a smart board like, oh, they're in surgery, or they went down for PT, or they went down and did something differently. So there's just a lot of ways you can combine those use cases.
Yeah, it's very cool. I think a lot about throughput too, and I think a lot about like ED boarding. And this is, oftentimes we're talking about like psych boarding, and like there's no rooms in other hospitals that these people need to go to. But a lot of the problem is just general ED boarding, right? They don't realize a room's open and all that. So and it not only makes a big financial difference for a hospital, especially like a smaller hospital that's facing all these cuts, but especially for the larger ones that are super busy and don't have the time. So that's super cool. I didn't think about that.
I think it also goes into this concept of world models, right? I mean, world models are like, AI models that include, other inputs, right? And RFIDs and like physical presence is another really critical input to make the application of these tools more real, right? You would have more information that would be relevant to the actual task you're trying to complete.
Yeah, if I could just kind of geek out a little bit, I would love a model where world news, weather, traffic patterns, events in the area. You can model out like, what's the likeliness of staff calling out, and we have all this data over a period of time, so you can kind of understand how do I get the right amount of staff to be able to handle what's going on. For example, if there's a marathon, there's a concert, you might have more people coming to your ED, so you might want to staff up because different things are happening. Or hey, it's raining outside, there might be more accidents, or you might have a little bit more call outs. Those different things, or you might have delays in people picking up their loved ones for discharge. So I think AI kind of brings all those different things, models those things out over time. You have a much more robust predictive environment.
You are going to love the pit when you ever find that time to watch it, because all those things you're talking about are covered in the actual show.
I haven't watched it either.
I'm their biggest hype person, apparently, clearly.
I don't think you are. No, I hear about it from like everybody watches the pit. Like it's totally a thing. So except for me and Boyede, we're the only ones.
Maybe not next month. I want to get some time. I'm going to check it out.
Yeah, he's guys. Yeah. Wait. So tell us, like, what else is going on at Zebra? Like, what do you like? What's exciting? Like, what should we all be like looking for here? Because we've been thinking so much about like some more boring stuff that like this is not something we think about much.
Yeah, I mean, how do you get when you say boring stuff? It might be exciting to me, but might not be exciting to you.
Well, we say boring, but we talk about it all the time. Like we talk about like policy, Boyede. So like our definition of boring is like pretty boring. So you're probably gonna like stun us.
I love policy conversations, and I take those conversations and then inform our product team as far as like what they should consider, like the technology needs to be able to address these different policies. Like if you think about concepts around wound care and present on a mission and cameras and be able to capture that, and how do you do automatic data entry. So there's a lot of things that we work through, but also one of the cool things about Zebra is that we don't do this by ourselves, right? We do this with an ecosystem of partners, both ISVs or software partners, and we work through a channel as well. So when we think about it, we're one part of a larger solution stack. So how do we play in those solution stacks? So one of the things I'm really excited about is there's an announcement with a company by the name of Ava that comes to mind, and we have others, Tiger Connect and others that we work with, and not to kind of drop names and advertise. I'm not trying to advertise, but these are the ones that kind of come to mind with around the leveraging AI and clinical collaboration and communication, and how do we create a more hands-free environment for our clinicians. So when we think about when you go into we care for a patient, I'm thinking about my time caring for a patient. I'm gloved up all the time, I'm touching stuff, I'm touching the computer, doing all different things. How do we really kind of enable hands-free documentation and care, leveraging ambient technology and, let's say, a wearable badge, whereby, again, we think about this sensitive environment, I'm able to care for the patient, and all of my communication with the patient is documented like a nurse. Nursing documentation is different from physician documentation, which is very more narrative driven. Nursing documentation has check boxes, and we have our PI, SOAP, all these SBARs, all these different styles of documentation, right? So how do we kind of bring this all together, specific for nursing, to then enable them to do their work more efficiently and also decrease the cognitive load associated with nursing. Because when we see to replace a nurse right now, on average, and costs may vary depending on where you are, on average across the board, $60,000. That's to replace somebody that's on onboarding, recruitment, getting them through, and then within a year or two, they're gone.
Yeah. That's not salary replacement. That is the cost to get a new nurse in.
Exactly.
Yeah,
It's not your pipeline, and you want to have a good mix of seasoned nurses and new nurses, your nurse residency programs, and these are the backbones of many hospitals. We're seeing strikes left and right, and some of the things that we're seeing with the strikes, we talk about policy and bringing it back down to tech, is around the thought process of, one, the multi-generational workforce. Two, a lot of people are making decisions based on the technologies that hospitals have. Right? Do you have technology that's going to make my work harder, or do you have technology that if I get into a jam and I need a distress functionality, do you have that? I mean, I'm here in Chicago. An officer got killed at the hospital, at Swedish hospital.
Wow.
The number of violences taking place at the bedside is increasing.
Yeah.
So we're seeing more and more technology is really becoming a differentiator in the retention conversation.
Yeah. That's not awesome about the violence, but that's awesome, like how you're thinking about it. It's also like, can I just say, like, I love it when companies actually employ people who are using their product. Like, so you actually know what's going on.
The coolest thing.
It's totally
the coolest thing you could do. Shout out to Zebra.
Shout out Zebra. And also, and like your like attention to policy and like how do you turn that into something useful for hospitals? That's really cool. So Boyede, we are out of time, and it's like Friday at 4 Eastern, so I gotta go. Lisa still has to work. I don't know. And you're in Chicago.
My day is not over yet.
You got like a little bit more time, but give our loyal fans one more parting thought before we jet out for the weekend.
I like to say that here at Zebra, and specifically, one of the things, again, you mentioned what I like. We also have a growing group of nurses that are informing the technology. Oftentimes, we see a lot of tech companies build products and then look for problems. We're really looking for the problems and matching our technology for the problems. We might not be the best for a particular problem you have, but we might have a partner who can work. So I think one of the things that I really want to shout out the company for, and I'm not a company man, anybody who knows my history, but again, we're changing the culture around technology and technology adoption with making sure that you have the people you're building for informing the product direction and strategy direction for your company.
Love it. Well, thank you, Boyede. Thank you to your chaperones who are not on screen, but we probably should have brought them on and been funny about it. You're great. Love talking to you. Let us know what you think of the pit. As you can see, we have many loyal fans interested in your thoughts. So,
if you copy my name right here, you can find me on LinkedIn. Feel free to send me a message in mail.
Awesome. Love it. Well, thank you all. Have a good weekend.
Thank you. Have a great weekend, everybody.
All right.
Bye.